Started. Okay, just give me 1 second. We'll wait for a couple people to roll in here. All right, just setting up the Facebook Live as well. So for whatever reason, something happens on here, you can check out our Facebook page, Community Natural Foods. We'll be live streaming from there as well. Okay, perfect. All right, let's get started. So tonight's talk is all about integration for inflammatory bowel diseases, so IBS, Crohn's, colitis, etc. Tonight we have the privilege of speaking with Dr. Alex Smith. She works out of Nirvana Health Clinic here in Calgary and focuses her practice on gut health and hormone health as well. So I will hand that off to you.
Hi, everyone. Thanks so much for joining us. As Leanne has already said, I'm Dr. Alexandra Smith, and I am practicing out of Nirvana Naturopathic Medicine. And we're going to talk today all about inflammatory bowel diseases. So as Leanne mentioned, that includes IBS, IBD, which are Crohn's and colitis. Leanne, do you want me just to kind of dive into what those are before we go back and forth?
Yeah, I was just going to start by asking, maybe kind of go into an explanation of, the differences between those.
Sure. Yeah. So for inflammatory bowel syndrome, this is a diagnosis of abdominal pain and changes in bowel movements. It technically has to happen 3 times out of the month, which is not very much in order to get this diagnosis. But it's essentially just an umbrella term for something's going on in the gut and you're having either constipation or diarrhea associated with it. Abdominal pain, super common, bloating, super common with that as well. And then IBD, or inflammatory bowel disease, Crohn's, colitis, bit more of an intense diagnosis. This is an autoimmune condition where the gastrointestinal system is being attacked. With Crohn's and colitis, it's an inflammatory condition. So there's lots of inflammation in the gut, and then you're actually producing small lesions throughout the gut. Crohn's is gums to bum, is as we call it. So that means that you're getting lesions throughout the entire gastrointestinal tract, whereas colitis more so in the lower areas of the gastrointestinal tract. So that's our large intestine and anal region.
Perfect. And what would some of those symptoms look like?
Yeah, so that's a really good question. In terms of irritable bowel diseases, so that inflammatory condition, lots of abdominal pain, fatigue is a very common symptom, so more systemic symptoms that we're seeing, or whole body symptoms, as well as bloody stools and diarrhea. So those are usually the cardinal signs that you should get tested for inflammatory bowel disease. Usually with a diagnosis of irritable bowel syndrome, you are not seeing any blood in the stool. So it's not considered that inflammatory process like what is happening in IBD.
Yeah, I think IBS, like so many people now have been being diagnosed with IBS. Is there kind of like you rule out other things and then we just call it IBS, or?
Yeah. Oftentimes it's a diagnosis of exclusion. And lots of times people have been tested for H. pylori, for example, is a super common bacteria that's tested when there's any kind of gastrointestinal upset. Also, people will run a fecal blood spot test to make sure that there's no blood in the stool. That rules out that IBD component. And then if nothing else can be found and you still have these symptoms going on, that diagnosis of IBS is usually the one that you'll get.
So what are kind of the first steps if you've been diagnosed with IBS, you're still kind of struggling? Let's talk a little bit about diet, and maybe, I don't know if it's a blanket approach or very individualized, but what are some diet options that people can start doing to help with their IBS?
Yeah, diet is definitely one of the cardinal things that we need to work on with a diagnosis like IBS. Lots of people are noticing certain foods may be triggered or triggers for their IBS-like symptoms. So trying to nail down what those triggers are is important to be able to take those out of the diet so that you're not experiencing that as much. But eating foods that are easily digestible, especially now that we're into wintertime, it's a bit colder out there, moving away from cold salads and cold foods, moving more to those warm cooked soups, warm cooked vegetables that are easy to digest for the gastrointestinal tract is really helpful. And then avoiding things like spicy foods. And sometimes even coffee can be a big one for people with irritable bowel syndrome in terms of it causing a lot of diarrhea, a lot of discomfort for people. So that's another one that sometimes needs to be taken out of the diet. I'm not a huge fan of diet restriction. I find it can be really, really hard for people to just be taking things out. So it's how can we get the best whole foods diet and nutrient rich foods in a way that you can digest them. So like I said, for this time of year, it's definitely moving more towards those cooked foods, cooked vegetables with a good protein source. Eating organic when possible is the best so that you're not getting those pesticides on top of that can increase inflammation in the gut. So choosing those kind of options is a really good idea for irritable bowel syndrome to help with just that kind of day-to-day management.
Yeah. What are your thoughts on fiber? I know some people are very sensitive to different types of fiber, and we hear so much about how it's so important for gut health, but a lot of people, it can make things worse. So is there, specific types of fiber that are better than others for people that have IBS or any kind of inflammatory bowel disease?
Yeah, so that's a really good question. And fiber can be a bit of a tricky one in terms of fiber being really, really hard on the gastrointestinal tract for some people, like you just said, Leanne. That I find is more so due to the gut microbiome because fiber feeds our gut microbiome. So if within that gut microbiome, and that's all of the bacteria, yeast, parasites, worms that may be in the gastrointestinal tract, if we have that dysbiosis or those bad microbes in there, fiber is going to feed those too. So fiber, really good to feed good bacteria, but it doesn't have a choice in terms of what bacteria it's going to feed. It's going to feed whatever is in the gastrointestinal tract. So before I'm recommending increasing fiber for people, I'm usually looking in the gastrointestinal tract and actually testing to see what those microbes are so that we can restore that healthy gut microbiome and then move on to more fibrous like options in terms of restoring that gut microbiome and then feeding the good bacteria rather than just adding in the fiber. We don't know what's in there and we're potentially feeding those bad bacteria and making people or symptoms worse.
Yeah. So would that be like as part of the protocol then to, if you did a stool analysis and there were like maybe candida or parasites or things like that, is the goal to kind of kill that off with things like wormwood or black walnut, those types of herbs first, and then kind of go from there?
Yeah, exactly. So kind of my first step when I'm working with patients with irritable bowel syndrome is that I'm looking in the gastrointestinal tract to see what the gut microbiome looks like. So are there dysbiotic bacteria in there that we need to take care of before we're moving on to diet restoration? So with that, a lot of people have something called small intestinal bacterial overgrowth. That's a super common one. And about 60 to 80% of patients that are dealing with IBS-like symptoms have SIBO. And that's the underlying cause of it. So using herbs like wormwood, I use a lot of hydrastis or golden seal as well. Garlic is another really, really good herb for SIBO-like bacteria. But essentially a broad spectrum antimicrobial is what we need to use. And then because these bugs are pretty smart, when there's that dysbiotic bacteria, whether it's SIBO or some other kind of bacteria, fungus, yeast like candida, we need to use something called a biofilm buster.
Hmm.
Essentially what that is because these microbes are so smart, they build like a mucous membrane around themselves. And that mucous membrane is what protects them from our antimicrobial treatments. So if we're using herbs like wormwood, like hydrastis, golden seal, that's not able to actually penetrate the bug, it's just breaking down that mucous membrane.
Hmm.
What a biofilm buster does is it actually breaks open that mucous membrane and then allows our antimicrobials to get in and kill the bug itself. So I usually find that in a combination with a biofilm buster, much more effective at treating, so that you're not on these antimicrobial herbs for a really long time.
Right. Yeah, they're quite strong.
They're quite strong. Yeah, totally.
What would be in that biofilm buster? What is that?
Yeah. So there's lots of different things that we can add in as a biofilm buster. Probably the most common biofilm buster is N-acetylcysteine. Now,
Oh,
N-acetylcysteine has a lot of other functions in the body. It's a super important compound. It's the precursor to glutathione as well, which glutathione is our #1 antioxidant that we have in the body. It's produced in the liver. So in combination with what it's doing with a biofilm busting action or breaking that mucous membrane open, it's also helping with detoxification through the liver. So N-acetylcysteine is the #1 product that I use as a biofilm buster. And it's really quite effective at what it does.
oh yeah, I've never heard that. I've always, well, and N-acetylcysteine I feel like is quite popular right now.
Totally.
Yeah, like as you mentioned, that antioxidant or precursor to glutathione and then lung health. But I never knew it was biofilm. So that's very interesting.
Yeah, so it's biofilm, and then also recent research has just come out that it's really, really helpful for blood glucose balancing. So
Oh,
if there's any concerns with insulin regulation or the development of type 2 diabetes, N-acetylcysteine is a good supplement to be on in terms of helping regulate that as well. So it has it's a tool used for multiple different conditions, so it's a good one.
what does the research say for a dosage of N-acetylcysteine then?
Yeah, so usually it's about 600 milligrams twice a day.
Okay.
Now, everybody's a bit different with a biofilm buster, and we just essentially we don't want to overwhelm the system when we first start these treatments. So start slow, and then we can slowly increase if you're tolerating the treatment well, right? So
Yeah.
I usually start at about half of that, and then I'll increase to the 600 milligrams twice a day. And that is an effective dose as a biofilm buster and for general liver support, blood glucose support, all that stuff.
Right. Getting back to SIBO a little bit. So when I was tested for SIBO, it was the saliva test, I believe. Yeah. So like that's probably important for people if they suspect they have SIBO, but what are those symptoms quite similar to IBS generally, or are they kind of different symptoms from SIBO from IBS?
Yeah, that's a really good question. So SIBO is a really interesting diagnosis as well, in terms of it essentially presenting pretty much the same as IBS, but most commonly people have bloating with SIBO. And with SIBO, small intestinal bacterial overgrowth, we're having bacteria grow in our small intestine that shouldn't be happening. We should have most of our gut microbiome in that large intestine. So the problem there is that there's bacteria growing in the small intestine that cause us to bloat with any food because they feed on the fiber of food. And as they're feeding, they're producing gases. So those gases from what they're eating on is generally what's tested. So I've actually never heard of a test for saliva for SIBO, but you might have done a breath test, Leanne.
Oh, sorry. Yes, it was
Yeah.
breath.
Okay. Yeah. And so the breath test, essentially in order to test and figure out what's going on if SIBO is actually there, is it's a fast before you do the test. We essentially starve those bacteria. And then you take a xylitol solution. That's a sugar-like solution that the bacteria are going to feed on. They're going to eat up that solution, produce the gases, and then we test your breath to see do those gases actually increase in your breath sample? And that's how you get a diagnosis of SIBO through the breath test. And it's looking at two different gases. So it looks at hydrogen producing gases, which is more commonly associated with an IBS diarrhea picture. So that abdominal pain, bloating, and diarrhea is more consistent with hydrogen-like bacteria. Or you could have methane producing bacteria. And those methane producing bacteria generally cause constipation. So people will feel bloated, but also have constipation. And generally that's a methane. However, everybody's a bit different, and you can have both bacteria and have constipation. You can have both bacteria and have diarrhea. It's more so what's your genetic predisposition to develop which one, but there's a bit of association in terms of what bugs are coming up on that test. And then there's one other bacteria, gas that the bacteria can produce, and that's a hydrogen sulfide bacteria. That can't actually be tested in our SIBO breath tests. But usually that hydrogen sulfide produces really, really foul smelling gas. So that's an inclination that that should be a piece of treatment, is taking care of that bacteria as well.
Oh, interesting.
Yeah.
Is there, like you mentioned garlic and golden seal, is there specific herbs like that for the specific types, or is some better for like hydrogen versus the methane?
Yeah, that's a really good question. So in terms of the hydrogen, we use more so oregano for that one. Okay, and then for methane is more so garlic. So usually a broad spectrum SIBO antimicrobial is used, but making sure that the formula for hydrogen producing bacteria has that oregano in it, and then for the methane producing bacteria has that garlic in it, is important, just to make sure that yes, you are treating with broad spectrum to make sure you're taking care of all the bacteria, but with a focus on a methane producing one versus a hydrogen.
Right. A lot of people are very interested or are advised to take probiotics. I feel like sometimes that can add fuel to the fire. Is there a specific type, like the soil-based probiotics, that might be safer, or different strains that might help versus cause more issues?
Totally. So that's a great question too. In terms of probiotics, because small intestinal bacterial overgrowth, if we're talking specifically about that diagnosis, because it's happening in the small intestine, if we're adding in a probiotic without using any antimicrobial treatment, we're adding fuel to that small intestine. We're increasing the bacteria in there, right? Even if we're adding in the good stuff, we're still adding in more bacteria to that small intestine. So it's more important that we're on a good antimicrobial treatment and then adding good bacteria back in with an enteric coated probiotic that allows it to go all the way to the large intestine. Most of the probiotics, and I know the probiotics that are at Community, have that enteric coating.
Yeah.
In terms of being able to get all the way to the large intestine before they're being broken open and flooding the gastrointestinal tract. So that's really important. And that's what you want to make sure that is in your probiotic, so that they're not breaking open in the stomach and then feeding that SIBO in the small intestine.
Right.
So making sure that you're picking a probiotic with that, but then also considering that if I haven't actually taken care of the underlying infection, is this probiotic even going to be effective, right? With just flooding the gut microbiome, it can help just to not allow more bacteria to grow. So not make symptoms worse potentially, but there still is that underlying infection that you want to take care of.
Yeah, I think for diet purposes, I remember someone recommending the FODMAP diet kind of as like the last step once you figure out what's going on, and then kill off some of that bacteria, and then it's kind of the diet to kind of reduce that as well. Do you typically recommend that as well?
Yeah, if it's strictly SIBO, I will typically recommend the low FODMAP diet. I don't usually recommend it during the killing phase, however, because I want those bacteria to be active.
Right.
I don't want them to go dormant. So another kind of tricky thing with IBS, SIBO, intestinal bacterial overgrowth, is that these bacteria they're smart. They can start to just hide and not be super active so that they're not feeding, but they're also not being killed. So I usually don't recommend that low FODMAPs diet right away.
Right.
We start with that killing protocol, and then within the gut healing protocol, once we've taken care of the infection, a low FODMAP diet is definitely a consideration, just to decrease the likelihood that any of that bad bacteria is going to grow back. But as you probably know, Leanne, the low FODMAP diet is quite restrictive. It takes a lot of foods out of the diet. So I don't want people to be on that for long term, just because it's quite restrictive and you can't enjoy a lot of really healthy, really good foods because they're fermentable. And that's the biggest thing with the FODMAP diet, is we're just trying to get food out of the diet that is going to feed those bad bacteria. But again, if we haven't taken care of that underlying infection, we're essentially just waiting for that to come back as soon as you start eating those fermentable foods again.
Yeah. Oh, I lost my train of thought because I saw the question pop up. Since I just saw that question, I forgot to mention at the beginning. Yeah, we might answer a few throughout the presentation tonight, but the majority of questions we will get to at the end. So if you guys do have questions, definitely type them out here in the chat box or the Q&A box, and we'll do our best to get to all of those. Okay, I remember what I was going to ask. It was about, like, I remember going through the SIBO protocol, and the die-off was quite intense for me, and I've thought I personally should have had some support, like liver support, just to kind of help, the detoxification of that. Is there other things like supporting your liver, or maybe, infrared saunas, things like that, to help kind of balance out that die-off?
Totally. So liver support is the number one thing that I focus on with balancing out that die-off. We want to make sure that those bacteria are being killed, but also getting out of the gastrointestinal tract. With knowing that our liver is connected to our gastrointestinal tract, and that bile secretion, or what comes out of our liver, and that detox product, bile, helps to move the gastrointestinal tract along. So helps us to poop more, essentially. With that being said, focusing on liver support and making sure that all of our detoxification emunctories are open is a really good thing. So with that being said, things that you can do within your diet for liver support, as well as topically for your liver. Infrared sauna, great thing for detoxification systemically. It's essentially going to cause you to sweat, which our skin is our biggest emunctory, our biggest detoxification organ is our skin, because it's all over our body. So if we can get sweating, that's going to be good to open detoxification pathways. Second thing is castor oil, which you can apply topically. Do not take castor oil internally. That is a big no-no. But applying it topically over your liver, which is just below your rib cage on the right side. I usually use about a quarter amount in the palm of your hand. You apply it over your liver, apply a heat pack, and then you go to bed. Castor oil decreases overall inflammation, but it also stimulates liver detoxification. So if your abdomen is also feeling inflamed from those detoxification killing off reactions, putting it all over your abdomen is not a bad idea either. Applying the heat pack completely over the entire abdomen works as well, to help stimulate not only liver detoxification, but also to help stimulate decrease in inflammation in the abdomen. That can be really helpful to help just clear that infection or those die-off reactions. Other things to add into the diet, lemon water in the morning. 1 glass. Don't drink lemon water throughout the whole day. It can be super hard on your teeth because it's acidic, but just 1 glass of lemon water in the morning, that stimulates liver detoxification. That gets our liver going. Starts that detoxification pathway essentially by increasing acid in the stomach, increasing digestive juices. So our pancreas starts to increase function in terms of releasing digestive enzymes, and then our liver starts to release bile. And that's kind of the first step in starting digestion. So doing that in the morning and getting that liver detoxifying right away is a good thing. Exercise is also great in terms of getting you sweating like the infrared sauna to open up those detoxification pathways, and then getting enough sleep. Sleep is super important, super foundational. It's one of those pillars of health. So getting enough sleep is when our immune systems are the most active, right? So when we are asleep, our immune systems are working to detoxify, to get bad bacteria out of the body. We need to sleep when we're in a killing protocol. Making sure you're getting at least those 8 hours would be wonderful for just giving your body the best chance of fighting off this infection.
Yeah. So if you're not sleeping well, it's probably not a good idea to do kind of a detox protocol
Yeah,
like that.
totally. Yeah. And restoring that kind of foundation, making sure that you're sleeping well, that you're not in a super stressful environment either when you're treating this is really important. Now, stress and SIBO kind of go hand in hand, and we can kind of dive into why that is too, if you'd like, Leanne.
Yeah, I was just going to say, I feel like we can't not talk about stress when we're talking about IBS and SIBO because they go hand in hand.
Totally. Yeah. So this is a huge topic. And I mean, just with the 21st century, we all have busy lives. We're running around. Stress is a real thing. And it's not that all stress is bad stress. It's just chronic high stress can be really hard on the gastrointestinal tract. And the reason for that being that when we're under a lot of stress, we release a hormone called cortisol. Now, I'm sure a lot of you have heard of cortisol before and understand that that is your main stress hormone. But essentially what cortisol is for is it's increased so that we can run away from a bear if we need to. So if we're in some kind of situation that we need all of our blood going to our muscles, we need to increase our heart rate so that our heart beats faster. We need to increase our lung capacity, our eyes dilate so that we can run as fast as we can. That's great. We want cortisol in those situations. But if we're sitting at our desks, we're about to eat lunch and we're feeling like that, we have no blood in our gastrointestinal tract that is going to help digest our food. When we don't have blood in our gastrointestinal tract that's helping to digest our food, we're not secreting enough stomach acid. We're not secreting enough digestive enzymes. We're probably not secreting enough bile from the liver. So digestion can kind of come to a halt. And a lot of people experience chronic constipation with stress. And that's because we're not worried about digestion when we're under high stress and our heart is beating really fast and we're trying to run away from that bear. Digestion is not the main focus at that point. So with chronic constipation, our stool essentially gets backed up. This is a really big common cause of SIBO development, is that we're not actually pooping enough. So those bacteria start to move up the gastrointestinal tract and can move into the small intestine.
Yeah. Yeah, I feel like stress, a lot of people don't realize it too. Like I know when I first started having like digestive issues, I just never kind of connected the two. But yeah, it plays such a huge role. Kind of like, you know, those tips of when you sit down to eat, like not being distracted, kind of eating slowly, chewing your food, being really mindful of how you eat can even make a big difference as well.
Totally. Yeah, that's a huge one too, is that we're in a lot of times in this kind of like grab and go state where we don't think about what we're going to eat. We just start eating. And kind of there's 3 phases of digestion. The first phase is the cephalic phase, meaning the brain phase. And this is where we're actually smelling our food, preparing our food, thinking about what we're going to eat. That starts to increase saliva in our mouth. And it also starts to increase stomach acid, as well as digestive enzyme secretion and liver secretion. And then the second phase of digestion is actually chewing our food, so mechanic, which a lot of people just wolf down their food and don't actually chew it properly, so then it doesn't digest properly.
Yeah.
And then the kind of third phase is that chemical, where it's in the stomach and actually being digested by the stomach acid, by the digestive enzymes, by the bile to digest the fat. So once that stage happens, if we've not thought about our food and now we're wolfing down our food, we're just relying on that chemical digestion. to happen. And so, like you said, Leanne, bringing mindful attention to our food and actually sitting down, taking a deep breath before we eat, bringing attention to that and making a bit of a ritual out of it can be really helpful to heal the digestive tract. If there's underlying infections, of course, we need to treat those, but we still don't want these things to eventually come back, right? So we have to lay that groundwork with digestion once we've taken care of those infections and lay that groundwork so that these things do not reoccur.
Mm-hmm. You mentioned digestive enzymes and bile and things like that, and stomach acid. You know, while someone is kind of working on bringing down their stress, do you recommend, you know, maybe taking a digestive enzyme or HCl supplement or something like that to kind of help aid that digestion as well?
I do usually recommend that for sure, especially with certain bacteria that are in the gastrointestinal tract that we know can decrease stomach acid, like H. pylori. And the way that H. pylori survives is by decreasing stomach acid. So
Right.
it is something that I use within my practice to help restore digestion a bit quicker while we're working on those mindful techniques. I mean, it takes time, right, to bring attention back to that and have a bit of a ritual with your food.
Yeah.
So sometimes a digestive enzyme is needed in order just to essentially retrain the gastrointestinal tract to actually secrete these things itself. Sometimes it needs to have that acid in order to be stimulated. So whether it's a digestive enzyme or just betaine HCl, I use a combination in my practice. But for the most part, I move towards digestive enzymes with betaine HCl just to help restore that digestion a bit quicker.
Yeah. Yeah. It also seems like it kind of just gives your body a break too from trying to perform all these functions.
Yeah, absolutely. And just give the digestive tract a little bit of a chance to heal, right?
Yeah.
And another thing, just kind of talking about some symptoms, heartburn is super common with this stuff too. And a lot of my patients experience heartburn. Now, heartburn can come from eating too fast, for sure. So thinking about mindful digestion, important, but can also happen, and a lot of people find this a bit counterintuitive, from low stomach acid.
Mm-hmm.
With low stomach acid, we have essentially a little sphincter at the bottom of our esophagus. So that's the tube that goes down to your stomach. And that sphincter's mechanism to close shut nice and tight is stomach acid. So if we don't have enough stomach acid, it's going to sit slightly open and then acid can come straight through. And essentially we get heartburn symptoms from that.
Yeah. Yeah, it's definitely quite common. I know so many people struggle with that. And while, yeah, some of the over-counter stuff might kind of help, you know, calm things down, but in the long run, yeah, trying to get to the root cause of that. Is there things to kind of help other than like the HCl? Yeah, is there other ways to kind of help increase that stomach acid
Yeah,
than
totally.
supplements?
Yeah. Other than supplements, did you say?
Or I should say supplements, and like, is there specific like apple cider vinegar or other things like that?
Totally. Yeah. So that was going to be the one I was going to mention. Apple cider vinegar is wonderful at helping to increase that stomach acid. Sometimes I'll have patients do just a little shot of apple cider vinegar before they're about to eat. Doesn't need to be more than about a teaspoon. Some people love the taste of apple cider vinegar, some people don't. But it can be very, very helpful in terms of just increasing that stomach acid and getting those digestive juices flowing before we're eating. It can also just bring mindful attention to the fact that we're about to eat, right? So if we're doing some kind of ritual before we're about to eat, then we're thinking about, oh, I'm going to digest my food soon. And your nervous system is starting to think about that and starting to secrete those digestive enzymes, stomach acid, bile, to help with digestion. Another thing that can help is lemon. So if you really, really hate the taste of apple cider vinegar, you could always do a shot of like a squeezed lemon and a little bit of water. Something with acid is usually the most effective for that. Another thing to think about is bitters too.
Mm-hmm.
So when you think about kind of those pre-dinner bitter alcohols that lots of people used to drink way back in the day, the reason that they were so lovely before dinner was because that bitterness starts to help secrete our digestive enzymes, as well as stomach acid, as well as that bile. So helping to get those digestive juices going so that we can digest our food when we start to eat. I'm not suggesting taking alcohol before every meal, but having some kind of bitter, there's lots of bitter tinctures out there that just have bitter within them, which Oregon grape, hydrastis or golden seal is another super bitter that can really help with liver secretion and digestive enzyme secretion, stomach acid production.
Yeah. Yeah, lots of great options. I actually don't mind the taste of those bitters.
Oh, there you go.
I know. I wanted to talk a little bit about allergies. I don't know what your thoughts are in testing for allergies. Is that really accurate? You know, in terms of dairy or gluten, kind of those main allergies, or maybe just even an elimination diet might be a great option. But are there some food groups like that you typically tell patients to remove to kind of see if that helps calm things down?
Yeah, that's a really good question. So 3 biggest food allergens: dairy, gluten, sugar. The 4th one, probably nightshades. So that's your tomatoes, red peppers, things like that. I will recommend patients to remove those from their diet, especially if we're not seeing any kind of dysbiosis that may be contributing to these symptoms. Going to an elimination diet and taking those 3 out are usually the first ones because they're the most common. So most people react to those foods. We know that they're inflammatory foods. So that's generally a good place to start. In terms of food sensitivity testing or looking at food intolerances, food allergies, the testing, unfortunately, that we have out there is just not super accurate. So it's not necessarily the gold standard of testing. So we test, we can look at what your immune system is reacting to. However, within those tests, we have to understand that some of these are going to be false positives. So sometimes people have a lot of food that is in their high reaction category that they've never even eaten before. And that's cross reactivity generally between some food groups. So it's just taking those results with an understanding that as we remove all these foods from a food sensitivity test, we have to take them and put them back in the diet one by one to see if there's actually a true allergy there, or if symptoms actually get worse. Are you intolerant to that food, mildly sensitive to that food, or is it a full-blown allergy? With a full-blown allergy, anaphylaxis is usually the #1 sign. So most people know that already from those foods, but with those kind of intolerances, sensitivities, they're a lot more subtle. Sometimes it takes even up to 3 days to see any kind of reaction. And that's because they're a slowed sensitivity. So the immune system is reacting through IgG sensitivity, which is what we're testing in a food sensitivity panel. It's a delayed immune response. So lots of people with skin conditions can have some food sensitivity or that delayed response reaction to foods. Lots of people with IBS too. But just with knowing that these tests aren't 100% accurate, we have to do that food elimination of those foods that come back high and then the retest to understand if those truly are a sensitivity.
Right. Would you say the goal would be like, once you kind of, you know, whether it's SIBO, IBS, leaky gut, like getting your gut like back on track, is the goal to kind of then, you might have to eliminate foods, but you know, once things are working properly again, we can start eating those foods, even, you know, like the bad, you know, having the sugar and things like that every now and again. Like, is that kind of the goal, is to get our guts healthy so we can eat variety of foods back in our diet?
Yes, 100%. My #1 goal when I work with people with IBS and irritable bowel diseases in general is restoring gastrointestinal health so that they can enjoy foods in moderation. think we always come back to this with any topic, but foods in moderation, that 80-20 rule, we should be able to follow. Restoring gastrointestinal health is the first part of that. We have to take care of an underlying infection first, and then we have to heal the gut, which generally, just because these bacteria have broken down the gut and caused some inflammation, the small little cells within the gastrointestinal tract, they're called enterocytes. Those enterocytes essentially start to shrivel up and aren't as robust as they used to be. And then the junctions between those enterocytes become leaky. This is where leaky gut comes from. So that leaky gut allows for large particles of food to pass through, which then we can start to see systemic symptoms with an IBS picture. So symptoms like acne, weight gain, other signs of inflammation that we're seeing more systemically. First thing, take care of the infection, because we need to take care of what's breaking down those enterocytes. Second thing, healing the gastrointestinal tract, which usually we're using herbs like slippery elm, marshmallow root. L-glutamine is another compound that I commonly use for this, that essentially line the gastrointestinal tract and help to feed those enterocytes so that they can grow back nice and healthy, be super tight together again, and then we're not having that systemic inflammation from an IBS-like picture.
Yeah. Yeah, that's good to know. I think even just speaking with a lot of people as well, they're always so afraid, or they think it's like, I'm never gonna be able to eat anything ever again. And like, I've tried all the diets, and after a while, yeah, like that restrictive eating, it's so hard to do. Like you do it for 2 days and then it's, you're like, nope, I just can't do this. Like it's so much, it's so hard to do. Yeah.
And a lot of, sorry to cut you off there, Leanne, but a lot of patients I find, especially when there's something like SIBO or some other kind of dysbiosis going on in the gastrointestinal tract, they've eliminated gluten, they felt better for a little bit. Then symptoms came back. So they started to eliminate dairy, and then symptoms came back. Then they start to eliminate all sugar, and then symptoms come back. So then they've now restricted their diet down to so little foods because it's actually an underlying infection that's feeding on all these foods. And that's why they feel gross when they eat them, or they have those crazy symptoms of bloating and pain and diarrhea or constipation. And it's actually just that this infection has kind of started to feed on everything. So it can restrict people's diets incredibly. And then they really are at a loss in terms of, what can I eat that won't hurt my belly?
Yeah. Yeah, absolutely. You go down the rabbit hole.
Totally. Yeah. And it can be really hard to figure out exactly what those triggers are when you're at that point too, because like I said, with those food sensitivities or intolerances, they show up generally 3 days later. And so then you're thinking about, what did I eat 3 days ago? And oh, maybe it was the little bit of beet that I had or something like that, for example. Yeah. So it can be really, really hard to nail down what that trigger might be, but likely if you're reacting to everything and getting bloating with pretty much any food, it's an infection.
Yeah. Let's just talk a little bit. We have about 15 minutes left. So I just want to talk a little bit more about inflammatory bowel diseases. So Crohn's and colitis. Is there one main cause for each, or is it kind of a bunch of different things that happen for someone to get diagnosed with that?
Yeah, so generally, it's a genetic predisposition to develop an autoimmune condition. And then from that, epigenetic factors can speed up that diagnosis. So if you have a lot of inflammation in the body, then that could be the trigger. There's also some triggers or some research to show that some viruses can be triggers for an autoimmune process to occur. But generally, it's within a family history that you likely have that genetic predisposition to develop inflammatory bowel disease. And then it's just, when does it develop, based on kind of lifestyle, diet related factors. there's a lot of processed foods in the diet, and the body is under a lot of inflammation from what we're putting in it. We're not taking care of ourselves. We're not exercising a ton and that kind of stuff.
Mhm.
Maybe it'll happen a bit quicker than it would have. But it is a genetic predisposition for you to develop that.
Oh, okay, interesting. So what are some of the treatment protocols for those diseases then?
Yeah, so with inflammatory bowel disease, we really need to be careful in terms of what's in the diet that could trigger any kind of flare in that inflammatory bowel disease. Fibers can be really hard on people with inflammatory bowel disease, so usually that is out of the diet for the most part. And then there's lots of things that we can do in terms of helping to heal the gut, which L-glutamine can be really helpful. N-acetylglucosamine also has some good research on it in terms of helping to line that gastrointestinal tract, similar to what's happening in SIBO or IBS in terms of that gut healing, but helping to heal that gastrointestinal tract and line the gastrointestinal tract so that ulcers and lesions are less likely to develop. Slippery elm and marshmallow root can be considered as well, but you just want to be careful and go really slow with irritable bowel disease, just because you don't want to trigger any kind of flare with that. And then there's some good research in terms of certain strains of probiotics that are really, really helpful to decrease the likelihood of a flare for inflammatory bowel disease. And those include our bifidobacterium, as well as lactobacillus, and one strain of a strep bacteria that can be quite helpful just in terms of lining the gastrointestinal tract with a healthy gut microbiome, decreasing the likelihood that there's inflammatory bacteria in there, decreasing the likelihood of a flare.
Oh, interesting.
Mm-hmm.
Yeah, so kind of using all those tools. But yeah, I feel like it's very complicated, and I've known a few people, and it seems to be very different. And a lot of people as well, like symptoms, and yeah, and I feel like a lot of people struggle and they've tried everything. It can be quite complicated. So yeah, working with someone like yourself and really getting a hold of that before, potentially you might need surgery and things like that would be beneficial.
Yeah, absolutely. And then of course with inflammatory bowel diseases, stress is a huge component with those. So under high stress, more flares are likely to occur. So
Right.
Stress management tools and techniques like meditation or exercise can be helpful, but helping to manage stress and making sure that stress isn't a huge factor within that as well is really important, because that can really trigger a flare too. So that's always something, yes, we need to heal the gut in inflammatory bowel diseases, but we also need to consider what's going on lifestyle wise with our stress management and our sleep and all of our pillars of health, to make sure that those foundations are set in stone so that there's less likely triggers for flares. And oftentimes in inflammatory bowel diseases, the autoimmune paleo diet can be quite helpful, as long as you're staying away from those fibrous foods that are within that autoimmune paleo. But moving more to a diet rich in foods that are low likely of causing any kind of inflammation can be really helpful.
Yeah, perfect. Okay, let's get to some questions. Quite a few here. So is eczema in the face a sign of IBS or leaky gut or SIBO or all of them?
That's a really good question. That can be a sign of all three. Usually if we're seeing skin symptoms, it indicates that likely there is an infection there, but also that leaky gut has occurred. So like I said, with those enterocytes, those cells in our gastrointestinal tract, once those have been broken down, our tight junctions, or the junctions between those cells, can become loose and leaky and allow foods to pass through, increases inflammation, and then we can see it show up on the skin. The skin is generally the last place that we'll see something show up from an internal source, but usually is a sign that something's going on internally.
Someone is asking, would you recommend the plant paradox diet for leaky gut to treat IBS or SIBO?
The plant paradox diet, I honestly would have to look that up because I've never heard of that diet. So I'm really sorry.
Yeah, it's Dr. Steve Gundry. He talks all about lectins.
Oh, yes.
So
Okay.
removing lectins from the diet.
Yes, that can be helpful. Sorry, now that you're jogging my memory, I do know that diet.
Yeah.
Lectins can be helpful because we know that lectins cause inflammation. So that can be helpful for a leaky gut, but considering also low inflammation foods. So between the plant paradox, leaving out lectins, but also considering just general anti-inflammatory foods, that kind of autoimmune can also be super helpful. And then within that kind of gut healing process, low FODMAP can also be considered.
So you mentioned a higher protein diet for IBS, IBD. Are there better or worse protein choices? For example, pork, poultry, red meat, high, low fat, etc. And would consumption be at specific meals or avoiding them at certain times?
Sorry, I'm just going to pull up that question just because that was a long one. So that
I stumbled through it.
When we're thinking about protein choices, making sure that things are organic, grass-fed meats. So we're decreasing any kind of antibiotic or pesticides that meats might be eating when they're alive. Really important to decrease any kind of inflammation that may be coming from your meat. Usually poultry more so than red meat. Red meat can be quite inflammatory, same with pork. However, if you're getting it from a really good source, red meat is fine to eat once a week at a reasonable serving. It's just when we overload the system with red meat, we know that that can be inflammatory. So usually sticking to those lighter meats, but again, making sure that your poultry or turkey is coming from a grass-fed, free-range source is best.
Awesome. Another one. So are the Genestra HMF IBS relief probiotics helpful for IBS?
Yeah, those are really good. Genestra does probably the most research on their probiotics out of any of the companies within a professional probiotic line. They've done heavy research on probiotics for IBS specifically. So those ones can be really helpful. The only thing to make sure with those probiotics is making sure that they don't contain something called fructooligosaccharides. Fructooligosaccharides, or FOS, can feed the bad bacteria. They help feed good bacteria too, but this is why we recommend patients to go on that low FODMAP diet to decrease the likelihood that they're having any kind of fructooligosaccharide. So make sure that that probiotic for IBS relief does not contain FOS, and then that is a good brand for you to try.
Perfect. Can you suggest an N-acetylcysteine and a glutathione to purchase at community natural foods? There's lots of options, but maybe there's specific brands, because we do carry some of the professional lines like Genestra and Pure encapsulations. So yeah, do you have specific, what to look for when purchasing those?
Yeah, professional brand lines like they have at community natural foods are the way you want to go, just because there's third-party testing on them. So you know that what is on the label is what you're getting in your supplement. Community does an amazing job in terms of carrying those really good brands. So I would recommend the ones Leanne mentioned, Pure Encapsulations, Genestra or Soroil, and then AOR, I believe, is another one that you guys carry.
Yeah.
And I know they have a good N-acetylcysteine that's at a good dose as well.
Is there something you can recommend to relax LES if it's restricted and hard to move food into the stomach?
One thing that can be helpful is something called D-limonene. And also understanding or looking to see if there is an infection in your gastrointestinal tract would probably be a good thing in terms of understanding further why that might be happening, why the lower esophageal sphincter is not opening. Also adding in things if it is in response to digestion, bitters can be really, really helpful. So having a bitter tincture before you eat can help to relax that lower esophageal sphincter. And then bringing mindfulness techniques towards your food. So when you are planning to sit down and eat, taking a deep breath, thinking about what you're going to eat, allowing that saliva to start to build in your mouth can also help to release that lower esophageal sphincter.
Awesome. For the lemon water first thing in the morning, is it okay to mix it with the apple cider vinegar, with mother and manuka honey?
Absolutely. Yeah, that's a good combination.
Yeah. Delicious. How does gluten, starchy food, or spicy food affect IBS or SIBO?
So gluten or starchy food, because we know those are inflammatory, that's generally why it's affecting IBS or SIBO, in the fact that if there's a chronic infection within the gastrointestinal tract, you know that there's going to be some inflammation in that gastrointestinal tract. By adding in foods that we know are inflammatory, like that gluten or starchy foods, that can further increase it. Another thing to think about is just gluten and starchy foods like potatoes. They're harder to break down. So if we're not secreting enough digestive enzymes or enough stomach acid, bile, we're not going to be able to break those foods down properly. And then that can increase inflammation further as well. Because we know that SIBO and chronic bacterial infections that may be in the gastrointestinal tract can decrease our ability to secrete those digestive enzymes, to secrete the stomach acid, it can be affected there in terms of just your ability to actually break it down because you're not secreting enough. With spicy foods can just irritate the gastrointestinal tract. That's what spicy foods do. They can essentially cause us to have pretty wild diarrhea if we overdo it with spicy foods, especially for people with underlying IBS, but it's generally just that spicy foods irritate. So they essentially irritate the entire lining of the gastrointestinal tract because of that spice.
What is the big difference between IBS and SIBO? I heard you mention bloating and gas after meals. Is there other symptoms to be aware of?
So big difference between IBS and SIBO, not a lot. They kind of go hand in hand. So like I mentioned earlier, about 60 to 80% of IBS is actually SIBO. So most of the time, these are the same. Bloating and gas with meals, that's very, very typical of SIBO. And that's because you're essentially feeding those bacteria after you're eating. So that is probably the most common thing that maybe distinguishes a little bit between IBS and true IBS of just having irritable bowels and changes in bowel movements, and true SIBO, which is that kind of gas bloating picture. But I very commonly see those go hand in hand.
Mm-hmm. Any suggestions for homeopathic treatment for IBS?
Ooh, that's a good question. I don't work a lot with homeopathics as a naturopathic doctor, so I'm not really the number one person, honestly, to help with that. I believe IPECA is a good one for gastrointestinal bloating and that kind of stuff, so that might be something worth trying. A chamomile homeopathic can also be restorative to the gastrointestinal tract. With homeopathics, getting someone who's really well trained in homeopathics is probably your best bet for that. And that unfortunately is not my area of focus. So I'm sorry that I can't answer that really well.
I can't either. I struggle with homeopathics. Not that I don't believe in them. I can't wrap my head around like the concept of it.
I know, yeah.
Like, what is, yeah. Yeah, like you said, find someone who knows it very well. Okay, last question. So is there a link between IBS and our monthly hormonal fluctuations?
Yeah, so with our hormones, we have to consider that hormones are metabolized in the liver. And then essentially our liver produces that bile like we've talked about, and we poop that bile out. That bile helps to break down parts of our food, but it also is really important to detoxify different hormones and get them out of the body. So with IBS, more commonly with constipation than with diarrhea, but can happen in both, is that essentially that bile production has lots of hormones within it. Estrogens are most common to be reabsorbed in the large intestine, but any hormone can be. But with SIBO, SIBO can activate via something called beta glucuronidase estrogens and then have them be reabsorbed in the large intestine. And then that can cause hormonal imbalances. By having those hormones actually be reabsorbed and not eliminated through the gastrointestinal tract, we can start to have too many floating around, and then we'll start to experience symptoms of hormone imbalance. That's a pretty hefty topic, which we will be talking about hormonal imbalances on another webinar shortly, which I would be more than happy to dive into about that, because it is quite, there's just a lot to talk about within that.
Yeah, I think that one is in May, but yeah, just if you're on our newsletter or social media, definitely be sending out that notification for that webinar. So that is all the questions, and we've reached just over an hour, 8:01. It's pretty good.
Awesome.
Yeah, thank you so much, Dr. Smith, for sharing your knowledge. Super informative. And if you guys want to reach out, the email is info@nirvanahealth.com, or
Yeah, you got it.
Perfect. I will also be sending out this recording to everyone who registered tonight with that info. So if you guys want to reach out to her, definitely reach out through that email or give the clinic a call. They'll be happy to help. So yeah, thank you guys so much for tuning in. Again, thank you, Dr. Smith, and hope you guys all have a great night.
Thank you so much, you guys.